I'm asked this particular question, and I would like, this is not my answer nor the end of the session, right? The fact that there's no evidence to show that ATRS impacted outcome means that the relationship is quite remote. You identify some behavior that may result in better outcome, and you try to train your people, affect the behavior. But the fact that they learn it does not mean that they will behave the way they like it in your particular environment. There are a lot of contextual factors there. And under that situation, I think what Donald Berwick say is relevant. The usual method we do things, we observe, intervene and observe, and see whether there's any difference, does not become very useful in this particular setting. Context, mechanism, outcome approach may be better. That is, you understand why something can help, understand your own context, and see how you apply it accordingly to get your outcome will be more useful. So I'm going to talk about some of the mechanisms in which simulation can be useful in your setting. But first of all, let's look at what is simulation. It is not always the same high immersive simulation using high technology simulator. It can be anything else, hybrid, role play, park task trainers. And actually, it started a long time ago before we even have high technology, both in the East and in the West, when we're doing acupuncture or delivery. It is actually more a strategy to mirror, anticipate, or amplify the real situation and guide the experience in a fully interactive way. And actually, looking at it that way, trauma may not only benefit from the training itself, it actually can benefit from research. One example being the Stanford group want to see whether a certain checklist can help in settings when in an emergency setting in the OT, they find it very difficult to do it in the real setting, so they do it in a simulation center, and actually it gets published in the New England Journal of Medicine. And actually, also, we can do it with system integration. You look at different aspect of your own system and see where it helps, right? If you want to build a new trauma center, new OT, you can see how it works. Before it is being built, you can mop it up. And certainly, you can look in the equipment, whether it's useful. Here, we're doing a usability test on the infusion pump, but you can do it with other aspects of your equipment as well. And certainly, drill is to look into the process. And what about education itself? In education itself, if you look into the Kirkpatrick, there's a lot people have to learn under knowledge, skills, and attitude. And the traditional way is to break them down, and then we take them all, and then we think that, yes, they can do it. But more and more, we think that do not work with complex knowledge domain like trauma. People will be doing very well in your traditional exam, but when they go to the setting, they actually cannot apply the knowledge at all. And so we have to go on to do what we call holistic model. And basically, it will be problem-centered. So very well, we go down to the real setting, it will be good. But actually, it will be very difficult in the real setting to gauge the easy from the difficult. Ideally, you would like to start with a series of easy tasks and gradually reduce the support until somebody actually already mastered that before you move on to something more difficult. But that is very difficult to do it in the real life setting. You don't know what is going to happen next day. So, and that is very important because when we are learning, we work with very limited capacity in our working memory. And that will be affected by 3 levels. One will be, there may be some extraneous load. When you're watching this lecture, you may be checking on your cell phone, and that will take away some of the memory. We want to reduce it. And then there is the intrinsic load of the task you're going to do. And now you have the spare part will be what you do with your learning. So if your task is already very difficult, you don't really have enough of your working memory to do with the teaching itself. So that's why we have to grade it. And the ability to range the difficult levels is very important here in simulation because now you can design your task and move on. But of course, not all experience will result in education of learning. That's why Professor Duranto said that we need to debrief after a certain trauma itself. Well, that is based, of course, on the Kolb's learning cycle. And it is very good that in the clinical setting, we go and debrief the people, but there are difficulties there because you involve people who are doing the work, not somebody who watched everything happening. It's very seldom that you can do it. But in simulation, you have somebody who watched the whole thing and then debrief people. And there are very good assessment sort of guidelines in simulation to how to best debrief people. There's no time to go into the details here, but I would like to emphasize on two things. One is that it needs to be structured, the debriefing. Normally, we will structure it that way, and we look into the reaction of people as well. And the reaction of people is very important because sometimes going through this simulation experience, either it is not engaging, so people don't like it, fidelity issue, or they're so engaging, they have a lot of emotion, especially if the performance are bad. If you do not deal with the emotion, they're not going to learn because emotion comes before cognition. The other thing is that those things that they are really care about, they have a lot of emotion about, are really the agenda, form the agenda that we want to discuss later on. So dealing with the reaction phase is very important, and these are not normally handled very well in the real clinical setting, I think. And the second thing is looking into double loop learning. In the usual clinical setting, a lot of time we use plus delta. What goes right, what should be improved. That is, we based on what we observe already. That is useful, but a lot of the time, this single loop learning is not as effective as double loop. That is, we look into why people behave that way. They may be behaving the same, but the reason between different people could be very different. And if you do not look into the reason behind, they're not going to learn very effectively, especially for people who already have some experience. The way they behave could be very difficult. And there are different ways to look into the frame, why people behave different way. In Hong Kong, where I'm teaching, in the Innovative Learning Center for Medicine, we buy into this concept from the Harvard School, which is debriefing with good judgment, but certainly there are other methods to look into it, explore into the frame. So the third thing is, so that is very important, we can offer deliberate practice with feedback. It's very important. And the other thing, uncommon events like mass casualties or trauma in some unusual setting, this do not happen regularly, and you may not be getting those from your everyday work. Simulation will be useful, and certainly practicing in the simulation center will take away the risk to the patient. And another very important thing is whether we can reproduce it. In a normal setting, every trauma setting are so different. How do you assess your people? So if we can produce something which is more reproducible, we can actually assess our learner. And we are already doing it in a lot of our examinations already, OSCEs. But I think simulation-based assessment is something not that simple, because a lot of the time, your people do not behave in the way you do it, not because they don't know how to do it, it's because of our issues, the way we write our scenario and the way we conduct our scenario. Are they really realistic enough? Do people do not understand what is going on and therefore do not behave the way they should be? And so choosing the task is important. Designing a scenario to look into other confounding factors is important. And also, we have to develop appropriate metrics, and that is something not simple in itself. Now, when we say that can trauma benefit from simulation, we do not need to look into only what can help. But we also need to overcome some of the hurdles, why people cannot learn from simulation. Two things. One is that, the first two is that they do not think that it helps because it's not real enough, right? Realistic issue. The other two is equally real, is that, especially for people who are already experienced, performing before others is really threatening. So psychological safety is a very important thing. Let's look into the issue of psychological safety first. By nature, if people already have some experience, if you want to change their practice, they will have to come across something to unfreeze them. That is, they go into it, the way they do it just doesn't work, does not lead to it. So this by itself will unfreeze, and then they will change. And this unfreeze comes in the form of a surprise. And it already will make them feel bad because they do not get what they want, isn't it? And they feel bad already. And that is why psychological safety has to come in to help them. And psychological safety has been demonstrated to be a precursor of learning-oriented behaviors. That is, they have to be motivated to learn. And how do you provide psychological safety? There are a number of techniques involved. One will be to clarify the objectives. Why do we have to come and learn? To clarify between formative versus summative. We are in the medical healthcare profession, we go for a lot of assessments. We are very competitive profession. We want to perform. We want to be the top. But actually, in going through this sort of learning session, we are more likely to go through the formative process. We like to see how we can learn to perform better. So clarifying that will help. And the roles of people, what are the expectations that they have to come in and join, very important. The other thing is about confidentiality. That is, they will not reveal the issues to somebody they don't like to, right? Maximizing the transparency is very important. So when you come in, your performance will only stay in here. The group is not going to tell anybody about it. And they need to be shown respect. And that is one very important aspect in the adult learning theory, that adults, when they come to learn, they need to be respected. They need not be shied away because of something. And that is easier said than done, because when you see somebody performing not to a certain level, how are you going to show respect now? Because you are saying this guy is lazy, well, he's not learning. And that's why the basic assumption is important. When I go to Boston, well, they actually have this put on their wall. They have to say that we believe that everyone participating in activity there are intelligent, capable, cares about doing the best and wants to improve. And that is very important, because when we see somebody not performing as you expected, you have to show some curiosity. If this guy is already intelligent, capable, care about doing the best, but he still performs this way, there must be something that we need to find out to help them. And I think that only when we are really curious in mind, when we put out the thing in our words, we will be respectful. And that is not easy. That takes a lot of effort to build that sort of attitude, to be curious, to respect the people. And that is very, very important for the psychological safety. Otherwise, people are not coming here to learn. And the other aspect is the realism issue. People always think that, well, this is not real. This is just a mannequin. They do not feel real. The skins are cold, whatever. And we have to understand that there are actually three different modes of realism or fidelity here. What we're talking about just now, whether they look like, whether they feel like, they sound like, they smell like, this is the physical mode. But we actually also have to look into other modalities, the functional modality and the psychological modality. The functional one is that whether they will respond in the way you expect it to respond. They may not feel like that, but when you put your stethoscope on that place, do you listen to a sound that corresponds to that sound? Although the sound may not sound exactly the same as you expected. Can you interpret that way? And the third modality is the psychological fidelity. Do you feel the same? Do you feel that fear, that stress, and that boredom that way? The three modality. And these three modality works together to produce the realism and the engagement. And here, one thing we call fiction contract. The fiction contract is that before we go into the simulation, we have to be realistic. We tell the people that we understand there are limitations in this sort of simulation, but we will do our best. And we want the participant also to do their best to go in, so that they will understand the limitation, but they will be looking at it as if it is real. Now, physical fidelity sometimes is important. For example, when we try to intubate, and the physical measurement of the mannequin are so different from the human, this may not work. But actually, what is more important most of the time are the psychological safety and also the functional aspect of it is more important. So if we can build if we are actually fictional contract, meaning that the learner feel that the instructor are playing fair. That is, they also realize that there is some limit on their part, but they're willing to do the best. They will also be willing to reflect on their practice. That is what is found. So in summary, I think that simulation can benefit from trauma in a few aspects, in doing research, in system integration, and also in education, especially because we can provide deliberate practice and feedback in the form of debriefing. And also, we can expose them to uncommon events that do not normally come into practice in your own setting. It will be reproducible, and therefore, you can use it either for training, for assessment, and you can change the level of difficulty so that you can adjust according to the level of your trainee. And also, when you practice it, it will be no risk. But in order to benefit the learners, we have to address many different issues, especially the psychological safety issue and also the realism issue, by building an effective fiction contract with them. And certainly, we cannot deal with all the aspects. To be an effective debriefer, we need training. And say in Hong Kong, we have this comprehensive simulation educator course, which we run in June and November. If you're interested, you can check on our website. Thank you very much.